Our next startup is one that you might already know, especially if you were paying attention at Start Berlin or at the Business Angel Club of Berlin and Brandenburg, because they were pitching there quite recently. Their two founders quit their jobs to enroll in this incubator, and it's their first startup experience. And of course, their learning curve has been tremendous throughout the past months. And so let's get ready for the presentation from Anne and Patrick from Team MySkills.
Thank you, Justin, for this lovely introduction. So we start now.
Do it.
Hi.
Good luck.
Yeah, thank you. Hi, we are the founders of MySkills and my name is Anne. What if millions of mental crises could be prevented? People with a borderline personality disorder cost 20% of the costs of treating mental disorders in Germany. But why? This is Sally, and she has a borderline personality disorder. Sally's main problems are high tension, self-damaging behavior, and suicide attempts. In the next 10 years, Sally will be treated 8 times as an inpatient and will be dropped out of her therapy several times. During this time, Sally will wait for 3 to 9 months for her therapy places, and she will be admitted to acute care units because of a severe mental crisis. Dialectical behavioral therapy is a first choice and has the highest level of evidence in the treatment of people with borderline personality disorder. Today, the DBT offers Sally thick manuals for interactive skills training. It is very complex and Sally has to do a lot of paperwork. Also, the therapist is not available 24/7 and the aftercare is not guaranteed. As a DBT therapist for social professions, I worked for 6 years on a DBT station and saw many of Sally's problems, especially when Sally is on her own. Our advisor, Christian Stiegemeier, the president of the DBT Dachverband, is a great support for us. For more than 2 years, we have created specific solutions to Sally's problems. MySkills is a digital extension of dialectical behavioral therapy.
Hi, my name is Patrick and I have more than 10 years of experience as a UX/UI designer. MySkills is a smart companion app that supports Sally in her daily life by placing a personalized therapy toolbox in her pocket. The app currently supports replacing harmful behavior with new healthy strategies. User input and sensor data will assess and predict their emotional states and mental crisis to initiate personalized interventions from currently over 150 skills. This will be followed by personal assessment, reports and protocols helping analyze situation to prevent future crises. They can do it alone or together with a therapist. We create a unique user experience and customer bond by developing artificial empathy together with our strong partners, and at the same time, we meet the high requirements of regulation, data security, and evidence. We have already achieved significant improvements. The user data and feedback shows very clearly that our product works and is needed. Of 1.4 million people with a borderline personality disorder, 700,000 are treated every year. Our B2B2C business model is based on the new Digital Healthcare Act, also known as the App on Prescription. Our potential revenue in 5 years is 25 million euros per year. We are planning the listing in the DIGA directory in October 2021. There are only a few apps on the market. All of them have several deficits and disadvantages. MySkills will be the first app as a DIGA that can be prescribed specifically for people with a borderline personality disorder. And borderline personality disorder is only the beginning. We are planning to expand MySkills in Germany to other diagnoses that can be perfectly supported by our solution in the next years. We have many years of experience in the field of e-health services and all relevant areas, in technology, science, psychology, and of course in design. We have influential advisors, mentors, and partners on our side who support us in the development and spread of MySkills. We need 300,000 euros to expand our team and to meet the requirements for the DIGA directory. There are a lot of professionals just waiting to prescribe MySkills. Join us on this journey and help us to prevent millions of mental crises. Thank you very much.
Thank you very much. I really enjoyed that. What was the biggest challenge that you had to conquer in the past 9 months?
Yeah, wow, that's a good question. So we have a lot of challenges. Of course, we are a startup that brings a lot of challenges with it. But I think as many of us in this incubator and also who develop healthcare applications, there are so much difficulties in this healthcare system, dependencies and regulations that we need to tackle. But we have some very nice and good experts on our board that can help us with these hurdles and help us to proceed and fulfill all the requirements. Yeah.
And a question from the audience, and they're inquiring about this artificial empathy, and they're wondering what form does it take?
Yeah, sure. So we plan to do this in the future much more in detail. So we collaborate with some universities in the future that we can provide an AI-based technology that can predict emotional states from the text, from the input of the data, from the users, and also from the sensor data that we collected. And then we want to achieve that we can predict emotional states, and therefore we want to do much more research and evidence on the space in the next few months and years. And also we want to have some help in this kind of field that we need.
And how do you make sure that the patients use this long term? I mean, like borderline personality disorder doesn't just disappear overnight. Many people have it for life. How do you make sure that people keep using it long term?
Yeah, that's a really good question as well. So what you need to know about this borderline patients are have really often some such high tension and emotional and mental crisis, and that's not only in 1 month, one time, so on
a daily
or
basis.
on a daily basis. So they need help on a daily basis, and if they don't get help, they experience some really bad habits and dysfunctionality behaviors. And we help right there. We have a always available app that provides help in these kind of crises, and that's a way better, a healthy way to deal with these mental crises on a daily basis.
And since you're aiming for DIGA, one of the audience members wants to know if you can outline your RCT approach for getting accepted.
Yeah, so we want to do a first pilot study. We already have a product and a beta test that shows some significant improvements, as mentioned. And for the next months, we want to do a pilot study that collect the evidence and show the evidence. And with this approach, we will go to the DIGA directory, and as well with the complete study concept behind this. And for more details, we have especially one colleague of us what is specifically for this topic on board, and we can discuss this on a or on a call maybe later if you want.
Perfect, and that's a good reminder for people to book a one-on-one conversation below with the teams. So thank you again, MySkills. That was great. Thank you.
It was a pleasure. Thank you.